Okay. Good evening again, ladies and gentlemen. Thank you very much for waiting. Thank you for your patience. Good evening to those who have joined in after the initial greeting. My name is Alicia Whittingham Gale. I am the Staff Welfare Liaison Officer for Western Regional Health Authority. And this evening's Meditation Monday session, we will be looking at tooth talk. Now, October was internationally recognized as Oral Health Month. And so we can't just let October go by and not, do a session concerning oral health. So for this first meditation session for this month, we have with us Doctors April Stewart and Dr. Htein Aung, both from Trelawny Health Services, who will be speaking to us about some very interesting topics, dispelling myths in dentistry. We'll be looking at oral manifestations of COVID-19, and we will be talking about the ever-trending fake braces. Is it fashion statements or is it actually a risk? So we are happy that both doctors are able to join on this evening to speak to our audience on these topics. So without further ado, I will turn over the reins to our presenters for this evening. Thank you, Dr. Aung and Dr. Stewart, for joining, and I now hand over to you.
Thank you so much, Mrs. Whittingham Gale, and good evening, everyone. I am Dr. April Stewart, and joining me in this presentation is Dr. Htein Aung. So I will begin by sharing my screen. All right, so welcome to our presentation, which is entitled Tooth Talk. And as mentioned by Mrs. Gale, the topics for discussion are dispelling the myths in dentistry, fake braces, are they a risk or fashion, and the oral manifestations of COVID-19. So I hope you will all be informed and we will take questions at the end. So let's begin with dispelling the myths. So for my first myth, in Jamaica, it is believed that a pregnant woman during labor, the amniotic fluid or headwater, which they affectionately call it, leaves the amniotic sac through their oral cavity rather than the birth canal and spoils their teeth. So a lot of women who they have children and they'll come to us at the health center and they'll say, "Doc, please excuse me for how my mouth looks," because it's an insecurity for them. And they will tell you that, "Doc, when I had my son or when I had my daughter, this is what happened. The headwater came through my mouth and spoiled my teeth." And the first time I heard it, I was pretty shocked at what is really happening here and who is spreading this propaganda. But it is something that has been passed down for generations in our country. And I'd like to take this time to dispel this myth and then encourage you, if you have persons who are of this notion, or even if you don't know if they are of this notion, that you will share the truth with them. So the real deal is that there is no connection between the oral cavity and the birth canal. What really happens is that during pregnancy, women may experience episodes of vomiting that could arise from morning sickness, whether it's in their early stages or other triggers such as food and smells. No, these episodes of vomiting, it creates an acidic environment in the oral cavity, which erodes the enamel and causes the tooth to become more susceptible to cavities, fractures, and sensitivity. So on my screen now, I hope you are seeing the screen. You have, and I hope you are seeing my cursor. You have on the picture on the left, it has a mouth with cavities, especially in the front area where you can see there are cavities there. On the picture on the right, you have the surface which is eroded. The enamel there has been eroded, and these darker brown areas is actually the dentin, which is the layer under the enamel that is being exposed, and this is now sensitive. All right, so how can we manage this? How can we prevent this from happening? First of all, if you have somebody who is experiencing this, the person who are pregnant, are persons who have their children and they're experiencing these problems, you need to refer them to the dentist, or if you are having this issue, you need to come in to the dentist. And how we can prevent the erosion of the enamel is after the episode of vomiting, you should rinse the mouth with water, or if you are at home and you're able to access some baking soda, you can use a teaspoon in water and rinse them out with that and wait up to about 30 minutes before you go about brushing. So this will bring back the neutral environment in the mouth, right? So another tip is pregnant women during their pregnancy, they go through a lot of hormonal changes. And so they are more likely to develop gum disease, and in turn, it may affect the health of the developing baby. So we encourage women in whatever trimester it is to work hand in hand, just as how you're working hand in hand with your doctor for the safe delivery of your child, you should work hand in hand with your dentist just to ensure that your oral health is in good condition. On to my next myth, which is persons who actually believe that you should soak your mouth with alcohol or white rum specifically, or Pepsi after an extraction. So another example is a person will come to you in the health center, and it may be they have a hopeless tooth and they need an extraction to be done. They'll come to you and they'll say, and you'll be giving them the post-operative care instructions. And they'll say to you, Doc, I know everything. I know what to do. I know when I go home, I should just rinse my mouth with Pepsi. And again, you are in shock as to where are these people getting this information from. So as you can see here on the screen, there is a picture of a hopeless tooth that needs to be extracted. Now, after the extraction is done, there is a socket that is filled with a blood clot. And this clot is its purpose is to protect the bone during healing. Now, if they go home and they rinse with the alcohol or the Pepsi, or they rinse with any just regular plain water, what they are doing is they are dislodging the clot and creating a dry socket. So as you can see on this animated picture, this is the picture on the left. It shows the clot, which is being removed from the socket, and the picture on the right shows the now empty socket. And this is why it is called a dry socket. The dry socket is usually very painful. Its onset is about 3 to 5 days after an extraction. The persons may feel severe pain, and they may have a foul taste and odor in the mouth. How do we manage these dry sockets? So prevention is always better than cure. So post-operative care instructions are always given to patients. You can give the patient it before you have done the treatment, or you give it to them after. But some persons, they are still stuck in their ways, or they're still hold the notions that I need to rinse with the rum, or I need to rinse with the Pepsi after, and they will come back to you with the dry socket. So how do we treat this? So the person will have to visit the dentist now, and so we can clear the infection in the area and regenerate that clot. And then if all things goes well, we have a nice healed and sealed area. On to my third myth, which is the harder the toothbrush and the harder you brush, the cleaner you'll get your teeth. I'm sure a lot of us are maybe guilty of this, right? So what can happen if we brush too hard? You may have gingival recession, where, as you can see here, the gum are moving away from the teeth because the hard toothbrush and the hard force in which the person is brushing has removed the gum tissue from the neck of the tooth in this picture. Another phenomenon that can happen is toothbrush abrasion, where you actually wear away the enamel around the tooth. So you have to visit your dentist now for them to restore the tooth with a filling. So what is the real deal? It is recommended that a soft bristle brush is used with the toothbrush angled at 45 degrees at the gum line for a duration of about 2 minutes. So here's a picture of the correct angulation of the brush. And as I said, you need a soft brush. The fourth myth that I have is you don't have to take care of primary teeth or baby teeth because they fall out anyway. So yes, baby teeth eventually fall out, but passing poor dental habits onto your child can cause them a lifetime of oral problems. Baby teeth begin to erupt Baby teeth begin to erupt at about age 6 months old, and they shed at different times in their life. So imagine you have a child, you have not been brushing their teeth. I know the child may be afraid to brush because it is something new you're introducing to them. And so you will say, oh, doc, I don't want to brush their teeth because they don't want me to brush, or they don't want me to use a toothbrush in their mouth. But passing these poor habits on to your children will have them have poor oral health problems in the future. So here is a picture of a child that has multiple cavities on the teeth. And the process of tooth decay is very simple. If they are not brushing away the food and the plaque from the tooth, the bacteria that is in our mouth, is naturally in our mouth, feeds on the food and the sugars, and it causes an acid. This acid that is produced works on the tooth and causes cavities in the tooth. So how can we manage this? So at 0 to 3 months, gum care. So you can use rags with baby toothpaste or glycerin and just wipe the baby's mouth after they have had their feeding. 3 to 9 months, continue gum care and begin to brush. So as I said before, at 6 months, the teeth start erupting. So you can now introduce the toothbrush. 9 to 12 months, you brush those new teeth. 12 to 18 months, you keep brushing, and now you can introduce them to us and take them in so that they can be acquainted with the dentist and they know that it's okay and it's safe to go to the dentist, and they will keep that routine throughout their life. 3 to 6 years, encourage self-care with assistance. So now you are encouraging them to now brush their teeth, but you are there guiding them every step of the way. And diet and meal times. As I was saying before, that we need to watch the sugar intake that we give to our children, as well as meal times. Are we letting the child sleep with the bottle in their mouth at night? Are we brushing their teeth after they have their last bottle at night or their last snack or meal at night? So these are some of the things that we can do to ensure that our children are not developing cavities. Myth 5, if nothing now bother you, you don't have to go to the dentist. So this is arguably the biggest dental myth. Pain doesn't always coincide with problems initially. Having cavities and gum disease, you may not be able to detect them in the early stages. The problem is, once you begin to feel the pain, it has already evolved into an even bigger issue. You may end up needing a root canal treatment or an extraction, which could have been prevented with regular dental checkups, right? So here is a picture of a dentist. They're holding a dental x-rays. And as you can see, the person is looking at the x-ray. They are understanding, the dentist and the person, they are having a conversation on how best they can help them with their oral health. So the role of a dentist, what are we here for? So we're not here to just pull out your tooth when it becomes hopeless, or yeah, we're not just here for that. We're here for diagnosing any oral problems. So whether it is that you have cavities or you have gum disease, we're here to diagnose that. We're here to promote oral health and disease prevention. So you're cleaning, sealants for children. We create treatment plans that your plan can be as small as your exam and your cleanings. If you have any gum disease, you may need a little bit more care or a little bit more treatment planning, but we are here for that. And we interpret your dental x-rays. Dental x-rays are very important to detect cavities that may be hidden to your naked eye and to our naked eye as well. For my next myth, dentures should be worn throughout the day, and it is okay to sleep with it at night. So I like to use the flower pot example. So if you have a flower pot and you put that flower pot onto your lawn for however long you put it on, when you come back and you remove that flower pot, underneath the flower pot, the lawn is not as healthy or as lush as the rest of the lawn, right? So this is similar to what happens when you have a denture and you are wearing this denture forever and ever. You never take it out, right? So dentures should be worn for 14 hours, up to 14 hours a day, and it should not be worn for 24 hours. It can lead to gum disease, periodontal disease, dental caries, yeast infections, and other disease of the oral mucosa. All right, so this is one of the conditions that can happen to you if you continuously wear your denture without giving your oral mucosa a rest. So the picture on the left, it shows you the imprint of the denture onto the roof of the mouth, and you can see the redness around the imprint of the denture. Also on the picture on the right, it shows the imprint of the denture and the redness, and you can see a little bit of vesicles in the center there. All right, so this is denture stomatitis, and this occurs because of the person wearing the denture for long periods of time. The bacteria, not the bacteria, the fungus or the natural microbiome of the mouth contains candida, which is a fungus. And this fungus, it likes to live in areas where it's not so clean. And now this infection causes this redness and this irritation of the gums. So that is denture stomatitis. This is another phenomenon, which is a flabby ridge or an epulos fissuratum. And as you can see here, you see gum tissue kind of spilling over the denture. So this condition is another thing that can happen if we wear our dentures for too long, and this is specifically caused by an ill-fitting denture. So how can we manage this? So we can take our denture out at night. You place it in a container with water and a cleaning solvent. So here are pictures of just two of these popular solvents that you may be able to find at your local pharmacy. So that's Polydent and Efradent. May be able to find them at your local pharmacy. You can also use distilled vinegar. You can also use baking soda to add to the water to clean your denture. Now you should brush the dentures twice a day and also brush gums and remaining teeth. So persons will also believe that because they don't have any teeth in their mouth, they don't need to come to the dentist, they don't need to brush the gums or the remaining oral tissue. So we advise you to brush gums and the remaining teeth. If the denture is loose or ill-fitted, seek a dentist for adjustment. So it is recommended that dentures should be realigned or readjusted every 2 years, and the dentures be changed between 7 and 10 years. So some persons will have their denture for 20 odd years, it should not be the case. So as I said before, we should visit the dentist regularly. A lot of persons believe also that their way of life doesn't affect their oral health. So our oral health is like the window to our entire bodies and our entire health, right? And our diet and water intake, the medication that we take, lifestyle habits such as smoking and drinking really affect our oral health. Nutrition and oral health. So diet and nutrition affects the health of the tissues in the mouth, and the health of the mouth affects our nutrients. So the oral health and our nutrition work hand in hand. If you are not eating the foods that you're supposed to eat, you're not drinking enough water, your oral health is not going to be healthy. And if you have cavities and gum disease and you're having mouth pain, it affects how you eat. So, and also the consumption of sugars has been associated with an increased risk of developing dental caries. Medication. Many medications, both that are prescribed by doctors and the ones that we may buy from over the counter, may affect our oral health. And some common side effects with some medication is dry mouth or xerostomia, which is found in persons who may have diabetes and they are taking the medications for diabetes. It may cause them to have dry mouth. And when you have dry mouth, the saliva flow in the mouth is significantly decreased and you are more susceptible to having cavities. Also, some medications for some heart conditions, they may cause the gums to become swollen or thickened. So here's a picture of what it means when I say that the gums may become swollen or thickened. And this is known as gingival hyperplasia, which is an excess growth of the gum tissue. So management is visiting your dentist regularly. Ask your medical doctor if there are any alternatives to the medication you're taking. And again, drink lots of water. Fluoride treatment are readily available at your dentist for persons, especially with dry mouth, and saliva substitute as well for dry mouth. Social habits, drinking and smoking. Smoking, as well as beverages that are high in alcohol, causes dryness in the mouth. And as I discussed before, what the dryness of the mouth can do to our oral health. It also increases the chance of accidental trauma or facial injury. For persons who may become intoxicated, they have greater risk of falling and having trauma or facial injury. So thank you so much for listening up to this point. I will now turn over to Dr. Htein Aung to discuss fake braces, risk or fashion. So over to you, Dr. Aung.
Quick question, Dr. Stewart, before Dr. Ong comes on, just to clarify, were you taking questions at the end of the entire presentation or at
Yes,
the end of each segment?
yes, we'll take questions at the end of the entire presentation.
Okay, all right.
All right. Thank you very much, Dr. Stewart. Good afternoon again, everyone. So today I will be discussing two topics, fake braces and oral manifestations of COVID. So I'm going to share my screen. Is everyone able to see my screen now?
Yes.
All right. So fake braces, risk or fashion? Before we talk about fake braces, we will have to establish a few points. So these points are which specialist is eligible to apply braces, as well as how do real braces look like. So the first one, who are orthodontists? So orthodontists are specialized dental professionals who have undergone the dental school, the regular general dental school training, which is 4 to 5 years, as well as have gone into an additional residency training for another 2 to 3 years to become an expert at aligning teeth and jaw relationship. So they study, some of the topics that they study are the types of forces that are applied to the teeth and how it affects the movement of the teeth as well as the jaw growth. What are the appliances that they can use to apply these forces, as well as when is the ideal time to use these appliances on the age of the patient, as well as the bone growth over the years. The second point that I want to establish is what are dental or orthodontic braces? So dental braces are devices used by orthodontists to straighten the teeth. They help to position and align a person's bite by applying steady, controlled, continuous pressure for a certain amount of time. This amount of time is usually 24 months or 2 years. So after the completion of the treatment, braces are usually removed and a retainer is placed to hold the teeth into position as prescribed by the orthodontist. So throughout the entire portion of the treatment, the orthodontist will monitor the movement of the teeth as well as the jaw relationship of his or her patient. So to be able to differentiate between fake braces and real braces, let's get to know the components of the orthodontic braces. So if you can see my pointer, I will be talking about the first part of the braces, which is the ligature. So the ligature is a tiny elastic or an O-ring, as we call it, or a twisted wire that's used to wrap around the brackets of the braces. It helps to hold the arch wire, which is the main component of the braces that's used to apply the force. And it's used to hold the arch wire and the brackets together. The second component of the braces is the arch wire. So this is a piece of flexible wire which springs back into its original shape when it's maneuvered and when it's shaped to the shape of the mouth. So before a braces is applied, the arch wire is conformed to the shape of the patient's mouth and is tied to the brackets by slots. When the arch wire is applied, the arch wire will do its best to conform back to its regular shape. So during that time, that's the horizontal force that's used to position the teeth. The third component, which you can see as C, is the bracket. So the bracket is used to hold the wire in place and is usually bonded to the teeth and serves as an anchor point for each tooth to the wire. The fourth component is called a metal band. So the metal band is usually wrapped around the posterior teeth, either the molars, which are these large teeth, or the premolars, which are the teeth right before the molars. So the metal band provides more anchorage than just the regular bracket alone. And it's usually a cemented ring of metal that wraps around the posterior teeth. The fifth component is the elastic hooks and the elastic or rubber bands. These rubber bands are used to provide oblique forces or vertical forces on the tooth. And they are usually tied to the adjacent teeth or the opposing teeth by hooks and pins. So these are some parts of the braces. And in this picture, you have a few more parts, such as the coils, the separators, the different types of hooks, as well as the chain elastics or the chain ligatures. So what are some of the general disadvantages of braces? So whether it be fake braces or orthodontic braces, braces cause mouth sores or ulcers because they irritate the mucosa. They have sharp edges along the brackets, which tend to damage the mucosa over time. The second disadvantage is that it is difficult for patients to maintain good oral hygiene as the appliance serves as a trap for food particles and plaque. So for people with braces, after they eat, food tends to get trapped a lot more than people with no braces. As such, it should only be applied and monitored by a trained professional, such as an orthodontist, for only a specific period of time until you complete the treatment. Then you will be asked to remove the braces and put in a retainer. So what are some alternatives to braces? Some alternatives to braces that you'll see on the market are the Invisalign, the lingual braces, which we term as braces which are on the inside of the teeth, which are on the inside of the mouth, where you don't see it on the outside when you smile or when you talk. The last one is the ceramic braces, which are similar to the color of the teeth. However, you will see the arch wire still present inside the mouth. So what are some advantages of Invisalign, one of the most common alternatives in braces? So some advantages of Invisalign include them being clear, which can be an aesthetic preference for persons, and they're also removable. So the orthodontist who will provide you the prescription for the Invisalign will tell you that you're only supposed to wear it for a certain amount of hours during the day, and then take it off and clean your teeth. And then after that, you can wear it back on when you go to sleep. So this helps to control the oral hygiene of the person. And it also helps with being able to keep the appliance clean. So what are some disadvantages? Because it's removable and you have to follow the prescription of the orthodontist, it requires patient discipline. And some treatments are difficult to manage with Invisalign alone. So what orthodontists tend to do is that they prescribe the traditional braces first, move some of the difficult teeth that can be moved, and then they will prescribe the Invisalign as a softer alternative. All right, so we'll be moving on to fake braces. So just like dental braces, fake braces are made from a piece of wire with brackets either glued or bonded onto the teeth, just like the orthodontic braces, only that it's for cosmetic reasons. So what are some of the reasons of wearing fashion braces? Some of the reasons include the cosmetic appearance of the braces. It also serves as a status symbol for those of the rich and wealthy. And it's also, people also believe that it's a cheaper alternative to straightening crooked teeth with do-it-yourselves. So if you go on YouTube and you search up DIY braces, you'll see a lot of persons who are not certified to put on braces, but they will give you advice on how to make fake braces. So what are some tips for identifying fake braces? The first and most important question to ask the patient is where or which dentist was the treatment done with, or specifically which orthodontist was the treatment done with. So a few places in Jamaica where there are certified orthodontists are the Tin Guinness Club of Jamaica, Island Smiles Orthodontics, Mandeville Orthodontics, and Align Orthodontics. So at Tin Guinness, we have Dr. Beck. At Island Smiles, we have Dr. Meeks. At Mandeville Orthodontics, we have Dr. Thomas Blair, and at Align Orthodontics, we have Dr. Anna Law. So these are just a few places, few notable places that patients may respond with. So the second tip for identifying fashion braces is that fashion braces often only extend to the front teeth, where it's usually seen, whereas the orthodontic braces are bonded and wired to all the teeth. The third tip for identifying fashion braces is that they often lack the functional elastic bands and the hooks. So here are a few pictures of how fake braces usually tend to look. So as you can see here, the braces will extend only to the front teeth and sometimes to the premolars, but the orthodontic braces will extend all the way to the back teeth because the back teeth are provide a more stable anchorage for the movement of the teeth. Very often you will also see only the top teeth being bonded with brackets and arch wires in fashion braces, whereas the bottom teeth are not usually bonded. The third image that you see on the right here is very similar to the first and second image, where it's only bonded to the anterior teeth. And you also have crooked posterior teeth. So what are some of the specific dangers of fake braces? So we talked earlier about the common dangers of the orthodontic braces. Now, here are some specific dangers. So often the wearing of fake braces is not monitored by a trained professional. As such, prolonged neglect of poor oral hygiene will lead to gum and tooth infection. You may have tooth decay, tooth loss, as well as foul breath. You may also have choking if any parts of the fake braces break or the glue comes off the brackets. You may also have toxicity inside your mouth and body if it uses metals that contain lead. You may also have patients complaining of prolonged jaw problems where their chewing is impaired because the forces applied by the fake braces is not controlled. You may also have difficulty chewing or pain on chewing, which is usually a symptom of tooth infection. You may also have tension headaches where if the forces applied are not controlled, the teeth tend to be pulled in all directions, which will cause tension headaches to the ear as well as the head. So here's an example of the dangers of fake braces. So as you can see here, this tooth right here is already lost. And for those with the trained eye, if you look here, you will have something called pocketing, where there's loss of attachment of the gingiva over the teeth. So these teeth tend to be very, very mobile once you touch them clinically, and they tend to be very close to dropping out. All right, so that's for fake braces. Now we'll move over to the oral manifestations of COVID. So the first oral manifestation of COVID, as we recognize it, is the loss of taste, which is termed as dysgeusia, which coincide more often than not with loss of smell as well. So how does the loss of taste come about in the symptom of COVID? So it's speculated that the death of keratinocytes on the tongue, a type of cell on the tongue, and the desquamation of these cells, they block the taste buds physically as a barrier and adversely affect taste perception. So over time, as these cells shed, the taste perception returns in the patient. So it usually takes about 4 weeks to a few months for taste perception to come back in patients with COVID-19. So you have a picture of a patient who has been affected with dysgeusia, where you have desquamation of the papillae of the tongue, which block the taste perception. So as of August 2021, there was a meta-analysis study done of 310 research papers, which presented oral symptoms that were associated with COVID positive individuals. However, there has been no conclusive study on other direct manifestations of the coronavirus. However, there's been associated sequel, but not specific to the COVID infection. These sequel are usually caused by either the dry mouth that's caused from the COVID virus, which is a symptom of prolonged mask wearing, as well as autoimmune diseases. So just like the HIV, the COVID infection will cause autoimmune diseases, which tend to exacerbate all these symptoms that you see below. So the first and main one is the xerostomia or dry mouth. The second one aphthous lesions, or we termed it as oral ulcers. The third one is opportunistic infections of the mouth, including candidiasis, which are fungal infections, and the herpes simplex infections. You also have erythema multiforme-like lesions, angina bullosa lesions, Melkersen-Rosenthal syndrome, which is the swelling of the lip with fissured tongue. You will also have Kawasaki-like diseases, which is termed as multi-systemic immune disease, where you have strawberry tongue, bleeding of the lips, as well as red ulcers around the corners of the lips, and many other autoimmune symptoms. You also have vesicles and pustules formed in the mouth, as well as petechiae. So as you can see, more than 90% of these lesions are as a result of autoimmune disorders. So specifically, during the start of COVID, we've been advised to wear masks. So there has been a few disadvantages noted with wearing masks. However, the advantages greatly outweigh the disadvantages. So a few of these disadvantages are it exacerbates dry mouth. So how do we prevent dry mouth? Well, the simplest prevention is you have to be aware of your body and you have to drink more water daily. So anytime that you feel that your mouth is starting to get dry, you can have a water bottle with you and you just drink it and then put on back your mask. So because of this dry mouth, you will also have increased risks of fungal infections as well as bacterial infections. So in dentistry, a lot of symptoms such as tooth decay and tooth loss is caused by a lack of buffering that's provided by saliva. So saliva serves as a protective barrier for tooth against decay. If the saliva is taken out, the tooth is more susceptible to decay. You also have increased teeth decay, which is another symptom of dry mouth. So how do some of these listed symptoms look like in the mouth? So you have a few of these. In figure 1, you have Candida infection, which is a fungal infection where you have white oral thrushes on the lip, as well as desquamation of the papillae of the lip. The second one, in figure 2, you have angular cheilitis, where you have redness of the corners of the mouth, as well as ulcers on the hard palate and soft palate. So this is the hard palate in this area, and this from this line here to the back is the soft palate. So in figure 3, you have herpetiform lesions, which is present on the hard palate. So again, a lot of these symptoms are as a result of immunosuppression due to the coronavirus. So you have erythema multiforme-like lesions in figure 4, and in figure 5, you have Melkersen-Rosenthal syndrome, which is edema of the lip and the lower face, as well as having fissured, dry tongue. Right. So what are some of the management of COVID that we can do in the dental setting? So first and foremost, when you've identified some of these symptoms in the oral setting, you should refer to the medical doctor for testing and assessment of the patient's overall status. You should also isolate and quarantine once the status of COVID-19 is confirmed in the patient, as well as those involved with the patient. You should also keep hydrated. Advise the patient to keep hydrated by drinking water to prevent xerostomia. The patient will also go on antiviral therapy as suggested by the medical doctor. And to prevent more symptoms of opportunistic infections, you will be given chlorhexidine mouthwash, which will help to enhance the oral hygiene, as well as antibiotics and antifungals, which will do their best to prevent opportunistic infections from occurring. And that concludes my presentation. And here are some of the references that you can use to find the research for oral manifestations of COVID. Thank you. So now we will take a few questions that you may have for us, both Dr. Stewart and I.
Thank you very much, Dr. Aung. As you said, we'll go right into the questions. There was a question posted earlier in the chat, so let us start there. From Julian Jackson Scarlett, question was asked, or was it a statement? It says, similar to the push to get front of packet labeling, is there anything being done by the dental unit to get manufacturers to stop making medium and hard toothbrushes?
Okay, good evening again. I will take that question as it relates to any specific campaigns that are being put forward to stop the manufacturing of the medium or the hard toothbrush. I cannot speak on that. However, as dental professionals and dental teams in the health services, the public and private health services, we really go out and we campaign a lot, and we try to advise our patients not to use the hard toothbrush on the soft toothbrush. So in the supermarkets and pharmacies, you will see them labeled as soft, medium, hard, or firm. But as it relates to them stop making the hard or the soft toothbrush, I cannot speak on any specific activity that is done towards that. But as I said, we always encourage persons to use a soft toothbrush. So I hope that answers the question.
Okay, thank you. And Dr. Stewart, there was I'm not sure if you're able to see the chat. Rachel posted a question to you. Maybe you'd want to answer that one directly to her. While you look at that, I'll open the floor. Are there any other questions from the audience? Someone, Nurse Scarlett says that is asking for the benefits of flossing.
Right. So for the benefits of flossing, I don't think there was any mention of the benefits of flossing throughout the presentation. However, some of the benefits of flossing include being able to reach between the teeth. So the surfaces of the teeth, there are 4 main surfaces, which are the front, or which we call the buccal surface, and the back of the teeth, which we call either the lingual or the palatal. But there are 2 surfaces, which are the interproximal surfaces, which is the surface between 2 teeth. So the flossing helps to reach the interproximal surfaces and remove the food particles mechanically out of the surface. So some of the benefits is that it prevents cavities between the interproximal surfaces. So a lot of the times our patients will come in the clinic, but there is no obvious cavity on the outside of the mouth, but when you take an X-ray, when you take a routine X-ray, you will see a cavity between the two surfaces of the teeth. So that will prompt us that there's a cavity and the patient needs to do a filling to protect the interproximal surface. I hope that answers Miss Julian Jackson Scarlett.
Okay, thank you, Doc. Another question being posed, is halitosis curable or treatable?
Okay, I'll take that question. Okay, halitosis for persons who may not know what halitosis is, but halitosis is bad breath. Bad breath, right? So halitosis is in fact curable and treatable. It is treated with proper oral hygiene. It's prevented and treated with proper oral hygiene. So most times persons, halitosis may be caused by persons not knowing that it is very important to brush the tongue. Also, persons may have cavities in the mouth, and these cavities are infections and they are able to cause an odor as well. So halitosis, you need to come into the dentist to find out what is the underlying cause of your halitosis and how we are able to treat it.
Okay. A question from me, Doc. In the myths, I did not hear you mention this as a myth, so I'm wondering if it is really a myth or truth. But
Okay.
I've heard it said persons who do not want to go to the dentist because their reason is that the fluoride that is used, it actually causes damage to I'm not sure if it's the teeth or the gum or whichever part of the mouth, and there's nothing wrong with their mouth. So because of the fear of what fluoride that is used at a dentist will do to the mouth, they prefer not to go to the dentist. Is there any truth to that? Not sure if you've ever heard that.
I've never heard persons being afraid of the fluoride or coming to the dentist because of fluoride, but I can answer that. So the fluoride, what the fluoride does, so fluoride is found in our toothpaste, mouthwash. So toothpaste and mouthwash. So what the fluoride does is that the fluoride helps to strengthen the teeth. So we don't know of fluoride causing any harm, but too much fluoride can cause a condition known as fluorosis, which sometimes weakens the enamel. But the amount of fluoride that we are using and providing for you at the dentist is not going to cause any damage to you. If that answers the question.
Yes. Okay, another question in the chat. Does sinus draining contribute to bad breath?
Yes, that is also one of the contributing factors to halitosis, sinus problems. So you can visit your medical doctor or maybe within your medical doctor, and they are able to help you with the sinus drainage issues or the sinus infection. I saw somebody wrote that if the manufacturer stop making the hard or medium toothbrush, what would we use to brush the dentures? And that is a very good point. That's a very good point.
Well, I see Nurse Scarlett responded to say that the same soft toothbrush can be used to brush the dentures. So is it that it's better to use the hard toothbrush on dentures than the soft?
There are actually specific brushes that can be used to brush the dentures, and those are denture brushes. But I believe that the medium or the hard denture brushes could be able to better scrub the denture and remove hard particles that may be stuck on the denture. But as it relates the same, I hope she doesn't mean you're using the same toothbrush as in the oral cavity as you're using on the denture. You should not use the same toothbrush. You use a soft toothbrush for yourself, for the remaining structures, and then you use the separate toothbrush or a denture brush for your denture.
Okay, thank you. I got quite a scare personally when listening to the presentation on the fake braces. And when I saw that picture, that looked like the tooth pushed out of the gum and all the way up to the top of the mouth. That's quite scary. But I know that dentures can, I'm sorry, not dentures, braces can be quite expensive to get. Is this procedure done in the public health system?
In the public health system, no, we don't offer braces or orthodontic treatment.
Oh,
Doc, Scarlett here again. Explain to me, I'm not getting the rationale with the hard brush and the denture. So one, these teeth are not going to decay. And if you brush and care for them after meals like the regular teeth, why you need to use a hard brush to brush them?
Okay, hi, Nurse Scarlett. Why we need to use a hard brush? I believe that the dentures some dentures they usually some persons with dentures they usually accumulate stains over time, and maybe the harder brush will be able to get rid of the stains more readily than the soft one. But I'm not saying that you cannot use a soft brush on your denture. It's just a recommendation that it may help to remove stains that may accumulate on the denture. Does that answer your question, Nurse Scarlett?
Not really.
Okay.
Because a brush will not remove stain. Correct me if I'm wrong. If there's a stain, so like you have coffee or curry or whatever.
Right,
You would
but
have
that's
to,
why we are telling you should come in to the dentist. The dentist is also able to remove the more stubborn states then.
right.
Is that better?
Yeah, I'm good.
All right,
For me, it just boils down to hygiene.
right.
So once you treat it like your teeth,
Yeah,
then you
you
won't
will.
need to scour it. That's in color, in quotations, because that is what
Yeah,
the hard brush will be doing.
all right.
okay. Any other questions from our audience? Okay, it seems that all questions have been answered. Doctors Stewart and Dr. Aung, we thank you very much for imparting your knowledge to us and giving us a better understanding on the various topics that were presented and well presented on, I might add. Thank you very much to the audience for coming on and participating. We really enjoyed this session. It was very informative, and I'm sure that we are leaving this platform with more information that we are going to put in action or tell others about in our daily oral hygiene. So it is now 14 minutes past 7 o'clock. And at this venture, I think I can say that, yes, thank you, Mrs. Ellis. It was a very good presentation. So at this juncture, we can close off our evening session. Thank you again, Drs. Aung and Dr. Stewart, for presenting to us. We really appreciate it, and it was very well received by our audience. Thank you everyone for joining on, and join us again for another meditation session. By the way, just to let you know that if you missed most of it or any of it, or you want to watch a rerun of the session, this will be posted on the Staff Welfare Facebook page, as well as the Staff Welfare YouTube page. So you can always check out those platforms to watch the presentation again and to share with others to enlighten the rest of our staff population and our families. Thank you everyone for joining. Have a wonderful rest of the evening. God bless.
Thank you.
And thank you for having us.
Welcome.